Welcome. I'm Mayor Westmoreland, and I'd like to introduce you to Tyler Plewe, Deputy Director of Utah County Health Department. Is that right?
That's correct.
Welcome, Tyler.
Hey, thanks for having me out here.
Yeah. So one of the things that I get to sit in on that our residents don't get to are the weekly meetings with the Utah County Health Department. And so it's a real pleasure to have you here so that our residents can get to know you and get firsthand information from you about what your goals are, some of the programs you're doing, what they can expect, what the Utah County Health Department has to offer our residents here in Eagle Mountain.
I think specifically right now, we have a lot to offer with our programs. I think specifically right now what we're trying to focus on obviously is our COVID-19, the vaccine efforts that we have going on throughout the county. Up to this point, we started our vaccine rollout with COVID-19 in late December. That was limited to healthcare workers and some other essential personnel and staff. Around January, we started to roll that out to the plus 70 crowd, the plus 75 crowd. And now we are open to 12 and above for certain types of vaccine, mainly the Pfizer vaccine. We've been doing our vaccine efforts in Utah County. We have a lot of partners involved in this program, over 50 different people that we can get the vaccine from, whether it be pharmacies or hospitals or local providers, and also and some private providers, and then Utah County Health Department. Up to this point, we've been centering our vaccine efforts in Spanish Fork, in Provo, and in American Fork. And what we have is what we like to call high throughput sites. And what that is in our Provo location, we can do about 1,500 a day. In our Spanish Fork and our American Fork site, we can do about 2,500 shots a day.
Wow,
and so,
quite a few.
Yeah, so I mean, that's our focus, is to get as many people in and out as possible, and as quickly as possible. We can have a person in and out in about 25 minutes. Parking, get in, and get in their car and leave. But as we've kind of experienced over the last couple of weeks, that demand is falling for that high throughput area. But we realize that there are still people that want to be vaccinated, but for whatever reason, that type of setting just isn't for them. And so one of the things that we're trying to do now is to reach out to those people that we missed in that effort to do as many people as quickly as possible.
Now, you also do testing, though. Is that right, or is that another organization?
We don't do testing at Utah County. Utah County, the testing is done. The hospitals do the testing, and then there's some other private companies that do testing. And the testing depends on, some entities might require testing to travel.
Well, our viewers may have noticed we're out here at Cory Park, and we apologize for the wind, but our Eagle Mountain residents are quite familiar with the wind out here. Yeah. So, but there have been testing, a mobile testing unit out here at Cory Park in the past. I'm not sure exactly how often they've been here or what hours, so our residents may be familiar seeing that as they drive by.
Yeah, and that's not associated with us.
Okay.
So the testing efforts, depending on what was needed, were done through the state, but then they were funneled down to different organizations, companies, and some private companies did testing. So as Utah County, we didn't do that.
So, certainly as, representing Eagle Mountain City, we don't take a position on, we don't tell people to get vaccinated or not. That's their personal decision, between themselves, their doctor, whoever. We encourage people to do their own research, make a wise decision, and yeah, they get, it's America. They get to make that decision. But what you're doing is providing those that do desire to be vaccinated, giving them a more convenient opportunity to do that.
Yeah, exactly. And you know, at Utah County Health Department, we don't mandate that people get vaccinated either. Even with our own employees, we haven't given that mandate. But obviously, we feel that it is an important thing to do to stop the spread of COVID-19. You know, right now that is our efforts, and we strongly feel that the vaccine efforts have had a great influence on the decreasing of transmission within Utah County and with the state of Utah and in the United States. We can see that the numbers are decreasing. I think as a country, we're under 30,000 cases for the first time since June. And so that's awesome. And with this vaccine rollout, if we can continue to push forward as an individual and as a community and as a state, it's how we can get on top of it and return to some of these activities that we love. And we feel that, you know, this summer with a lot of the recent public health orders that have been rescinded by the governor, that we'll be back to a lot of our normal activities that we love. You know, Eagle Mountain, I know you guys have your summer activities that start in June, right?
They're starting up pretty quick.
Yeah, and hopefully it'll be a successful event for you guys out here. And you know, our goal, we're involved with a lot of your activities that you do out here at the Pony Express Days, and you know, we want it to be a healthy event and a successful event, and this is one of the components that we feel can make that successful.
We definitely appreciate your help and, you know, helping us get there to have you know, successful events and activities. Yeah. So tell us again now, if somebody chooses to, who can be vaccinated now?
Right now it's ages 12 and up.
12 and up.
12 and up, but if they are 12 to 18, they have to get the Pfizer vaccine. So right now, approved in the United States are 3 types of vaccines. There's the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. Right now, the only one that 12 through 18-year-olds can get is the Pfizer. And so if you go on, we have the Pfizer vaccine available at all 3 of our clinic sites.
And can they call to get that information of where and when they can?
And if you go into vaccinefinder.org, that will list providers throughout the county. When you go onto that and you click the specific site, you can click information, and it will display the different types of vaccines that are available at all those different sites. And so and then you can call them just to make sure that they have that Pfizer vaccine. But that is available on vaccinefinder.org. The other one is if you just call our helpline at Utah County Health Department, that number is 801-851-4357. Again, 801-851-4357. It's our call center that is dedicated specifically just for COVID questions, whether that be where they can go get a shot, to requirements, public health orders, whatever is needed. We have employees that are dedicated just to COVID-19 to answer any questions. So if you call up that number, they'll be able to get you in touch to where possibly if you're looking for one of the 3 vaccines, a certain type, where you can get it, where the locations are, and especially since a lot of people might be wondering where they can get the Pfizer vaccine, because that is the one that 12 to 18-year-olds can get. They'll be able to help you locate exactly where that vaccine is being given.
Thank you for joining us, and yeah, we look forward to a great spring and a summer with lots of fun activities. Make sure to join us for Pony Express Days. Thank you, Tyler, for being here.
Yep, thank you.
All right, we'll see you later.